The way prostate cancer biopsies are read, there can be a lot of subjective interpretations. Different pathologists can look at different things on the biopsy and interpret them in different ways. So what is cancer to one pathologist may not be cancer to the other pathologist. There can be various other variables too. The way a particular report is prepared in a particular lab can be different from how it's prepared in the other lab. Various aspects of the pathology report can be different from lab to lab. And that can have a very important role to play in how your treatment is planned, how your physician looks at your report, and what finally happens with you when you finally get treated for your prostate cancer. For example, there are various conditions that can look benign to a particular pathologist, but another pathologist will interpret them as cancer. There can be things such as whether or not your cancer is invading around the nerves, which can have an impact on what the stage of the cancer is. Last but not the least, the grade of your cancer can be interpreted in different ways by different pathologists. Some pathologists may interpret the grade of your cancer as a lower grade. Another pathologist reading your biopsy may interpret it as a slightly higher grade cancer. The grade of the cancer is important in terms of deciding how aggressive your cancer is going to be. In a nutshell, because of all these variations that can happen in terms of how a particular biopsy is read, I think it is very important that you have your biopsy read by a second expert pathologist. It is important that there is agreement between two different pathologists on what your biopsy shows, what the nature of your cancer is, what the grade of the cancer is, because that is vital in terms of deciding what your treatment is going to be and various other important decisions that are going to be taken in the management of your case by you and your physician.